Welcome to Comfort Time with Aunty Yunike, where we share testimony stories. Today we have a special guest, like always, but the special guest we have today is none other than Professor Boniface Mwambakawimbe, whom, if you remember, we had previously on a different topic. Professor, welcome to Comfort Time.
Thank you very much. I feel very much at home to be able to share this platform with our viewers.
So, Professor, it has been necessary to ask you to come back because of our viewers. If you remember, viewers, you've reached out to us because we talked of breast cancer and briefly on cervical cancer in our last episode. So for those who are watching this episode for the first time, Professor walked us through what we need to do in order to detect breast cancer early. And it will serve you well to check out that video that we did with Professor. So Professor, we've had to call you back because the men complained that you can not only talk about breast cancer and cervical cancer. We feel as men that we've been left out because we too are dying from prostate cancer and would like to hear your input on that. So we'll be very grateful, Prof, if you can walk us through that as well.
Thank you very much. Probably the beginning point is to just reflect or share some information on what is cancer.
Please.
Now, our bodies are made up of, if you break down our bodies to the smallest unit, we are just made up of cells. Except some of these cells are specialized and they form the brain, others are specialized, they form the liver, and so on and so on. But at the end of the day, we are just a collection of cells. And our current understanding is that at that cellular level, that's where things go wrong and cancer develops. Our cells have the ability to divide, but they also, there are control mechanisms which tell our cells to stop multiplying. And there are control mechanisms which tell our cells that when they are old, they should let go and die. Now, in a layman's language, what actually goes wrong in cancer is that these control mechanisms fail. They do not work properly anymore. Now imagine a cell will begin to multiply, which is perfectly normal, perfectly acceptable, but this cell does not want to stop growing. You end up with an abnormal growth, which we call a tumor, which may be cancerous. Or imagine the cells, when they are old, are supposed to know when they should let go and die, but they don't. And this appears to be a fundamental problem with regard to the development of cancers. Okay. Now, to make things even worse, if these cancers would just grow in one place, let's say the ear,
okay,
it would not be a big problem. You just go ahead and remove that part of the ear. And you have taken care of the problem. But unfortunately, normal cells know their boundaries. They stay, they grow in one place. But cancer cells are very truant cells. They are not obedient cells. Okay. They actually leave their original location and go wandering around the body and start growing Imagine if the original cancer began in the breast, these cells would go to the brain and start growing there and causing problems in the brain. Or they will go and start growing in the liver, cause problems in the liver. Or go to the lungs and cause problems. And this is what we call metastasis. This is one of the unfortunate features of cancers, which defines what a cancer is. It's the loss of those control mechanisms and the inability to stay in one place and not invade other tissues.
Professor, this for me is quite confusing, because my next question is, where does prostate cancer grow? Now, listening to your explanation that you can have the cancer starting in the breast, moving to your brain, or now I'm thinking, does it even matter where it starts? So what I'm getting is that cancer is cancer, and it will go and venture wherever it wants to. Is that the right picture, or did I get it wrong?
You are very right. What complicates the treatment of cancer is not that you have this abnormal growth in one location. Is that this abnormal growth has the ability to spread to other organs of the body and cause problems there. And really, you can therefore separate cancer into two broad categories. Any cancer, you can say, when it's localized, when it's in one location,
okay,
that is the best time to catch any cancer. Okay. If you catch it when it's still small and in a localized organ,
okay,
that is our best chance of curing any cancer. Okay,
so before it starts wandering around.
Exactly.
Wow. Yeah. So for the prostate, the locality is where?
Now, the prostate is a small gland. It's, those who play golf, you can see, if you compare the prostate gland to a golf ball, it would probably be just slightly smaller than a golf ball.
Okay.
And this gland sits at the bottom of the bladder.
Okay.
And through this gland passes a little tube or pipe, for lack of a better term, which we call the urethra, which actually carries urine from the bladder to the outside world, in the case of men, through the penis.
Okay.
And this gland surrounds the urethra. That is its location. Now, one of the important things about this location is that for us, we are fortunate that although when you look at a man, you cannot see his prostate gland because it's an internal organ, but fortunately, this gland sits right in front of the rectum.
Okay.
And that location is important for us, so that although you can't see the prostate gland, if a doctor puts his gloved and lubricated finger through the back passage, he can actually feel the prostate gland.
Okay.
And that way we are able to gain information on what's going on with the prostate gland.
Okay, so that is when you're testing, when you decide to do the test.
Exactly.
Okay, so then the test involves what? Just what you've talked about, or do you need to do blood tests? Or what else do you need to do?
No, in fact, we are fortunate that the scientists have developed a blood test.
Okay.
Now, there is a substance which is produced by the prostate gland. It is known as prostate-specific antigen. For short, it is called PSA.
Okay.
Now, PSA is normally produced by the prostate gland. So the presence of PSA is not a problem. Now, what has been observed is that in most cases of cancer of the prostate, the PSA tends to be elevated. So if you find an elevated PSA, it may be the first pointer that there is something going on with the prostate gland. And unfortunately, this would be a perfect test for prostate cancer, because you just do the blood test, and if it's high, this must be prostate cancer. But unfortunately, the PSA level may be perfectly normal, and some patients may still have prostate cancer.
Oh boy.
And to make things even more complicated, there are patients who have no prostate cancer at all, but they may just have normal enlargement of the prostate gland, and they will have an elevated PSA level. So we can't, yes, the PSA blood test is a useful tool, but it must be married with other findings.
Okay. So then the tests have to be complete. You can't do one and
leave the other.
Okay.
Yeah.
Okay.
The second test is really what I would describe as an internal examination. In medical circles, it is known as digital rectal examination. This is where a healthcare provider, usually a doctor, will actually feel your prostate gland by putting a finger, gloved finger, which is lubricated, in the back passage, and in front of the rectum, he or she will be able to feel the prostate gland and be able to appreciate whether it feels normal or abnormal.
So, Prof, I'm thinking, does race have anything to do with who gets more cancer and who doesn't? I've heard of cases where blacks, be careful because you are more at risk. And I'm thinking, why should that be? So is it true? Is it true that your race matters?
With prostate cancer, you are hit the nail on the head. If you are black,
you're more at risk.
You live in America, your risk of developing prostate cancer is 4 times the risk of your white counterparts.
Wait, Prof, wait. If you are black and you live in America, you still are at risk. But I was thinking, could it be the food that we eat? Is it the environment? Now I take it that our friends who live in America eat the same foods that the white Americans eat. So how come they're still more at risk?
Well, that clearly shows that the food is not a risk factor. If it was a risk factor, then you'd find the black Americans and the white Americans, the risk of prostate cancer would be the same. Now, coming back home, we know that prostate cancer is the commonest cancer in Zambian men. So, and I think all these pieces of information are pointing to the fact that the race and we, the black people, the black men, should be aware we are at increased risk compared to our Asian friends, compared to our white colleagues.
Okay. So it's something to do with our genes.
Exactly. You have hit the nail on the head.
Okay, wow. Okay. So meaning we just have no choice but to get ourselves tested in order to catch this early. It looks to me, Prof, like in all the cancers actually. It's like it's early detection that can save us.
That is the key. If we catch any of these solid cancers early, that gives us our best hope of curing these cancers when they are still in their very, very early stages.
So, Prof, the other thing is family history. Does that have anything to do with you having it more than the other?
Yes. If your grandfather had prostate cancer, your father had prostate cancer, your brother had prostate cancer, or your uncle had prostate cancer, if there is this strong family history of prostate cancer in the family, you are at increased risk of developing prostate cancer. And for you, you should be under increased agency to have yourself tested.
Wow. This is so scary.
But I think what is even more scary is the fact that prostate cancer in its early stages doesn't cause any pain. In fact, it's true for most solid cancers that in the early stages they do not cause any pain at all, any pain or discomfort. The affected individual will be feeling perfectly fine. You'll be feeling on top of the world, but that is precisely when you should be checked. Unfortunately for prostate cancer, there are really no early warning signs.
Wow.
When you read in the literature and they talk about, a person having difficulties starting their stream, passing their urine, experiencing pain when they pass urine, or waking up many times during the night to go and pass urine, all those are late symptoms. By the time you get any of these, the cancer is advanced.
Wow.
Additional symptoms may be the patient of complaining of joint pains, bone pains. That is now just telling you that the cancer has already left the prostate, has now reached the bones.
Other regions.
Now we are in a catch-22 situation. If there is no warning, what should we do?
Yeah.
What do you think we should do?
I think you've already said it, and you said it even before. The only thing we can do is get ourselves tested and tested all the time. For me, that's what I'm seeing as our only option.
But remember, I'll speak for my gender. We, the men, are very slow in seeking medical advice. We try to look for every possible excuse not to go and see the doctor. When you compare our men folk to our women folk, our mothers are very good at seeking medical care at the slightest provocation, for lack of a better term. So I think our grandmothers, our mothers, our wives, our girlfriends, our friends,
family and friends,
have an important role to keep encouraging us men to go for prostate cancer screening.
After 40 years of age or before.
Oh yeah, I think that's an important point that you have raised. We know, especially in the non-blacks, prostate cancer tends to occur after the age of 60 upwards.
Okay.
Now, it doesn't mean you don't get cases at
Earlier.
earlier ages, you do, but the majority of the cases will occur after the age of 60. And that's why the recommendation for non-blacks is that they should start screening for prostate cancer at the age of 50 and going upwards. But since prostate cancer is so common among us black men, I think we should lower the age to 40. From the age of 40, we should begin asking and making ourselves available to be tested for prostate cancer.
Thank you so much, Prof. I think this is going to be very helpful to the main folk. You have answered to their needs, their complaint that you were just concentrating on the women. So do you have any last remarks to all of us, to the men, the women? What will be your last remarks?
My last words are really words of appeal to our men, because there is a way of picking it up early when it is curable. There are two simple tests. The first one is a blood test, PSA. All of us have had a blood test. I don't think any of us would be scared of getting a blood test done. Secondly, it's an internal examination, a simple internal examination, digital rectal examination, which is done by a doctor. It may be a little bit uncomfortable, but I think it's probably more embarrassing than uncomfortable. And it just takes a few minutes. Guaranteed, you will not spend more than 5 minutes in the doctor's office. And those two measures can mean the difference between a normal life, your ability to die from other natural causes, and the ability to see your grandchildren and great-grandchildren graduate.
Wow, thank you so much, Prof. What I'm getting from this is that it does not matter what type of cancer it is. All cancers, our only chance is early detection. In the breast cancer episode, that came through very clearly. And in that one, we were appealing to the government, to the powers that be, to individuals, to our partners everywhere, to come on board to help us source mammography machines, because those we don't have enough of in our country, Zambia. But in the case of prostate cancer, that is not necessary. So all you need is just an effort to go to the clinic and get yourself tested. So ladies, gentlemen, boys, girls, let's talk to everybody we know and love to go and get themselves tested, whether it's for prostate cancer, whether it's for breast cancer, whether it's for cervical cancer, for any cancer. Because what I hear now is that cancers leave their locations to come and damage our brain, our legs, our bones. So really, the onus is on all of us to take good care of ourselves. It just takes a few minutes to have the tests done. So thank you so much, Prof. We're so delighted that you always make the time when we call. The main code, after you talk to the women, and now you are here showing that for you, men, women, you love us all.
It's always such a pleasure to share this platform and contribute to the good health of our people.
Thank you so much, Prof. So there you have it. We have all the information we've been crying for. Comfort Time is about encouraging each other and uplifting each other's lives. Let's continue to do that. Stay blessed. Comfort Time continues. See you in the next video.